guys, welcome back to my channel. So today we're going to be talking about diastasis recti, which is the splitting of your abdominals and why it matters if you are pregnant or more importantly postpartum with a diastasis. If you're new to my channel, my name is Erica, fully certified stop Pilates instructor, and worked with a lot of postpartum clients who ended up with a diastasis after having children, and that's normally the most common time when we will see a diastasis in clients. Diastasis can be the cause of lower back pain, urinary incontinence, pelvic and hip pain, and a load of other issues that sometimes can go a little bit undetected or undiagnosed. I will say that I am not a doctor, and if at any point you feel like you have any of these symptoms or you're worried about having a diastasis, I highly recommend you going to your doctor. So what is a diastasis? Diastasis is the separation in your rectus abdominis. So you have 4 layers of abdominals. You have your transverse abdominis, which is the deepest layer of abdominal muscle. You have your external and internal obliques, and then you have your most superficial or closest to the skin abdominal muscle, which is your rectus abdominis, or more commonly known as your six-pack muscle. Your six-pack muscle attaches at the bottom of your sternum to your pubic bone, and there are 2 sides to it. In between those 2 sides of rectus abdominis muscle is connective tissue that keeps them together. When you're pregnant, that connective tissue is meant to stretch, as are your abdominals. It's very common after pregnancy, during your postpartum window, to have a bit of a diastasis or a bit of a separation of that rectus abdominis muscle. Some women's bodies will naturally go back to size on their own, and they won't have a huge diastasis, whereas other women will continue to have that separation in between their abdominal muscles. And like I mentioned earlier, that separation can start to cause urinary incontinence. It can most likely start to cause some lower back pain as well as some pelvic and hip pain. That connective tissue can continue to stretch, and if it continues to stretch over time without being addressed, what can start to happen is your internal organs can start to push forward. And in most extreme cases, if you look at a woman who has a really extreme 4-finger diastasis, what you're seeing is no longer the pooch forward from the stretched out connective tissue, but you can actually start to see some of the organs pushing forward, which obviously is a bit of an issue. So it's important to address your diastasis sooner rather than later. How do you know if you have a diastasis? Luckily, there are 2 ways to know if you have a diastasis, and both are pretty straightforward. The first is you see that your stomach makes a bit of a cone shape or like an almond shape. If you flex forward, try to hold like an ab crunch, and you see this big pooch sticking forward, or if you look in the mirror and see that your abdominals start to make a bit of a cone shape, then it's more than likely you might have a diastasis, and again, best to get checked by your doctor. Another way you can know if you have a diastasis is checking yourself, although it is recommended that you don't check your diastasis often, because checking often can actually exacerbate the issue. So to check to see if you have a diastasis, you should lie on your back, relax completely, and then you can gently start to press in between your abdominals. Especially if you've had a baby, you'll probably feel like a slight dip in between your abdominals, a slight space. If you're not feeling it, also lift your head, neck, and shoulders up, not engaging your abdominals, but just lifting forward to look toward your pubic bone. Again, then you should be able to feel if you have a space in between your abdominals, or you'll actually see the space starting to push forward. A lot of women fail to recognize that they have a diastasis and will continue to berate themselves, thinking that they just haven't lost the XX baby weight. A lot of women used to come to me saying like, I have this pooch, I can't get rid of this pooch, I have a little bit of a belly, still can't seem to get rid of it. And I would say like 6 to 7 times out of 10, it was because they had a diastasis that went undiagnosed, and therefore they couldn't work on closing that space back up. And once they did work on closing that space up, they were able to get the appearance of a flat tummy, because of the muscle that was actually working to hold all their organs in was allowing the rectus abdominis to repair. What should you do to make sure that you don't exacerbate your diastasis if you think you have one? The number one thing is not to do crunches. Don't do crunches. A lot of postpartum women will get on the like trying to lose the baby weight train immediately after baby. The worst thing you could do is forward flexion. Forward flexion is the act of bringing your upper body forward, or you can think of it bringing the ribs down toward the pelvis. Bringing the tip of your sternum down toward your pubic bone will only cause the space in between your rectus abdominis to stretch even further, making the diastasis worse. Next question from clients usually is, how can I fix the diastasis? I can't do forward forward flexion if I can't do crunches. Best thing you could do is strengthen up your transverse abdominis or your TVA muscle. That's the deepest core muscle that you have, and that's the muscle that wraps back to front almost like a corset. It's the muscle you have that when strengthened is actually going to work alongside your pelvic floor to help keep all your organs in place and help heal the connective tissue in between your rectus abdominis. Let me know down below if you're interested in seeing some TVA exercises, if you're interested in seeing some diastasis recti rehab work. I can definitely put together a video of simple exercises that you can do at home in a really short period of time, maybe while baby is napping or when your toddler is playing, that are simple and straightforward and can help heal your diastasis. Okay guys, and that's it for today. Let me know if you have any questions about diastasis down in the comments below. Don't forget to subscribe, give this video a thumbs up, and I'll see you in my next one. Bye guys.